Hello, welcome to Raaonline. I am Dr. Raaon. Let's discuss post-gastrectomy syndrome. The syndrome includes a list of conditions after gastrectomy. The list includes bile reflex gastritis, dumping syndrome, afferent and efferent limb syndromes, malnutrition, nutritional deficiency, internal herniation, anastomotic stricture, marginal ulcer, recurrence are in the list. Now coming to bile reflex gastritis, this is due to the duodenal contents entering the stomach, obviously because the absence of pyloric sphincter. Bile and pancreatic juice along with duodenal juice can cause damage to the gastric mucosa. So there are two components to this disease, the reflex and the inflammation. The reflex is due to the absence of pyloric sphincter which has been resected. The second component is the inflammation. The bile acid and lysolecithin damages the mucosal barrier, causes hydrogen ion diffusion back into the gastric mucosa, leading to erythema, erosion and hyperemia. Alkalinity of the stomach encourages bacterial growth. The most important point to remember is bile gastritis is a pre-malignant condition for stomach cancer. So possible mechanism is a free reactive oxygen and nitrogen species released by bile in the stomach. Now bile reflex gastritis is completely asymptomatic. It can be symptomatic in the form of abdominal pain, dyspepsia, nausea, bilious vomiting, bitter taste, anorexia and heartburn. Gastroscopy will be the diagnostic method of identifying the bile reflex gastritis. Prokinetics is the treatment of choice. Doing a proximal jejunojejunostomy to prevent the reflex and the risk of malignancy being practiced extensively nowadays, so that the bile reflex gastritis is becoming obsolete. Coming to dumping syndrome, the loss of delay in the gastric emptying because of the loss of pyloric sphincter function causes dumping of the food into the intestine. So there can be two types, and early and late dumping. The severity is directly related to the type of surgery. Gastrojejunostomy, antrectomy, pylorectomy are responsible for dumping syndrome.